This case study presentation is on a patient who presents with primary progressive aphasia in the outpatient speech rehabilitation department of Staten Island University Hospital. For confidentiality reasons, this patient will be known as JN throughout the presentation. So just some background information on the patient. JN is a married 78-year-old male who currently lives in Staten Island, New York with his wife. He has 2 children and 3 grandchildren. He is a retired associate banker from Chase Bank, and he lived in Tampa, Florida for 6 years for work. He came back to Staten Island after being retired and has been living here ever since. Things he enjoys include traveling and spending time with his family. JN presents with primary progressive aphasia, also known as frontotemporal dementia. He previously completed speech therapy in the winter and spring of 2021, and he reported recently that his word-finding difficulties have gotten worse and are increasingly frustrating. A neurologist referred JN back to speech therapy due to these concerns, and he was evaluated in the outpatient speech rehabilitation department of Staten Island University Hospital in September of 2021. An MRI of the brain was done on JN in July of 2021 with and without contrast in the radiology department of Staten Island University Hospital. These findings were compared to the MRI that he had done the year before in June of 2020. In 2020, the MRI results indicated cerebral and corpus callosal atrophy. Findings from the July 2021 MRI indicated no evidence of acute intracranial hemorrhage, mass effect, or hydrocephalus. Age-related involutional changes and minimal chronic microvascular ischemic changes were found in his most recent MRI that was done in July of 2021. His medical history consists of aphasia, apraxia, gait abnormality, and vertigo. JN denies stroke, dizziness, headache, memory loss, and weakness. He also has no history of hospitalizations, CVAs, or TIAs. Primary progressive aphasia is a neurological syndrome in which language and cognitive abilities slowly and progressively become impaired. It is caused by neurodegenerative diseases, such as Alzheimer's disease, unlike other forms of aphasia that form mostly from strokes. The earliest diagnostic criteria for PPA include a decline in speech and language that occurred in isolation for at least 2 years after disease onset, and a classification of a primary progressive aphasia variant. The 3 variants are semantic, logopenic, and non-fluent/agrammatic. Some more characteristics of primary progressive aphasia include effortful and agrammatic speech production, atrophy in the inferior frontal gyrus, anomia, single word comprehension deficits, and atrophy in the anterior parts of the temporal lobe. Some characteristics that JN portrays specifically include word-finding difficulties, phonemic and semantic paraphasias, agrammatic speech, right hand tremor at times that are consistent with excitement, and these tremors do not interfere with writing tasks. JN was evaluated for outpatient speech therapy in September of 2021 after being referred by a neurologist. Subtests from the Boston Diagnostic Aphasia Examination was used to evaluate JN. Some findings below include that he struggled to accurately describe picture scenes when asked to describe the famous cookie theft picture and a picture of a soccer game. His speech was characterized as disfluent and agrammatic, and responses included phrases such as kids take cookie, father, mother, lawn, and washing pans. JN was able to receptively identify pictures, identify the function of objects, follow directions clearly, solve problems, and answer questions from a story. Some techniques that I used in treatment with JN included response elaboration technique, categorizing, reading via segmentation, and semantic feature analysis. His long-term goal, the patient will maximize communication skills for improved participation in the community. Short-term goals for JN included, the patient will verbalize 10 to 15 items per category with minimal verbal cues occasionally provided. The patient will verbalize reading sentences via segmenting with 85% accuracy and moderate visual and verbal cues rarely provided. The patient will describe pictures by producing complete sentences via response elaboration technique with 80% accuracy and moderate visual and verbal cues occasionally provided. And the patient will provide 3 features of common objects via semantic feature analysis technique with moderate visual and verbal cues occasionally provided. So the next few slides highlight what therapy looked like with this patient. So categorizing was one of the activities that we targeted. The patient was given a category, a piece of paper, and a pen. He was instructed to name 10 to 15 items within that category given. Examples of categories included fruits, desserts, kitchen items, vacation destinations, and items that are cold. Most times, JN required minimal verbal cueing to name at least 10 items in a given category. He requires multiple verbal cues to name up to at least 10 items in a given category that was more complex, such as vacation destinations. Another topic that we targeted in therapy to target his goal was reading via segmentation. So this patient was presented with paragraphs of about 5 to 7 sentences at a time. A slash mark, as indicated here, was placed in between sets of words, and JN was instructed to take a pause wherever there was a slash mark. Reading in segments helps JN to focus on accurately producing a few words at a time and just focus on how they are pronounced. At times, he would struggle to initiate speech production or mispronounce the words that he was reading. So something that I did to help him was that I wrote down the target word on a piece of paper and I broke down that word into syllables. And this technique helped JN to accurately produce the word. Another technique we worked on in therapy was response elaboration. So JN was presented with a picture scene portraying different actions. In this type of technique, the clinician takes the initial response provided by the individual and uses modeling or cueing to expand or elaborate on the information already provided. He was instructed to describe what was happening in each scene using complete sentences and elaborating on his responses. He performed well with this activity and rarely required cueing to describe the pictures in complete sentences. So this here is just an example of a type of picture that was used in therapy. So looking at this, JN would have to describe things such as what the girl is doing, where she is going, things like that. Semantic feature analysis. JN was presented with pictures of common items. This technique is a commonly used treatment method to improve naming and expressive language abilities in people with aphasia by providing an organized method of activating semantic networks. He was instructed to name as many features of the item as he could, such as its location, function, association, category, and properties. JN performed well with this activity and rarely required cues. Carryover was given at the end of every session. The carryover targeted a skill or technique that was worked on during that particular session to help JN maintain a home exercise program. He completed his carryover every session, and it was reviewed in the beginning of the following session. Some examples of carryover included picture describing via response elaboration technique, listing 10 to 15 items from 3 given categories, reading a short story via segmentation, or describing three features of common objects via semantic feature analysis. So after 10 treatment sessions, JN made progress in his goals. He continues to struggle with things such as word finding, and he demonstrates phonemic paraphasias. A progress summary was written which described what his current goals were, the progress he made towards those goals, and new goals. His short-term goals were modified. So these were the goals that were changed for the remainder of his sessions that I spent with him. The patient will verbalize reading paragraphs via segmenting with 80% accuracy and moderate visual and verbal cues occasionally provided. The patient will provide 3 features of semantic feature analysis with 75% accuracy and moderate visual and verbal cues occasionally provided. JN was an active participant in therapy. He came to every session with his carryover completed. He became frustrated at times when he cannot correctly produce words. He did indicate that his tremors have become worse and he interfered with his speech production. When he demonstrated difficulty pronouncing words, the student would write the word on a piece of paper and break that word down into syllables. This technique was helpful to JN as it helped him hear all the sounds in the words in smaller parts and helped him to accurately produce the word. Visual cues were also helpful for JN to accurately produce target words. For example, while reading via segmentation, the student would show JN a picture on her phone of the word that he was trying to say. JN was discharged from speech therapy at Staten Island University Hospital in April of 2022. He demonstrates a good understanding of techniques done in therapy to be on a home exercise program. He has made progress in his goals and continues to work on these exercises at home with his wife. JN was advised to visit his primary care provider if symptoms worsen, and a referral to speech therapy will be made if necessary. And here is a list of all the references that I used in this presentation.